Our trusted, easy-to-use 15-minute COVID-19 test can now be used in your own home, on your own time, without a prescription. The BinaxNOW COVID-19 antigen self-test is conveniently available over the counter at a retailer near you. This video will show you how to use the BinaxNOW COVID-19 antigen self-test. Before starting the test, carefully read the full instructions that are in the box. The box includes 2 tests for repeat testing. Simply test yourself twice within 3 days, at least 36 hours between tests. By testing more frequently, you may detect COVID-19 more quickly and reduce the spread of infection to others. In the box you'll find 2 test cards, 2 dropper bottles, 2 swabs, an instruction sheet, and a COVID-19 fact sheet. You will also need a timer, which is not included with the test. Gloves are also recommended during test, but are not included. First, prepare for the test. Wash or sanitize your hands. Make sure they are dry before starting. Take 1 test card, 1 dropper bottle, 1 swab, and your timer. Remove the test card from the pouch and lay it flat on a table for the entire test. Keep testing kit and kit components out of the reach of children and pets before, during, and after use. Make sure there is a blue line showing in the result window. If you don't see a blue line at the control position before starting the test, do not use the test card and contact technical support. Open the test card so it lies flat on your table. Do not touch the test strip. Remove the dropper bottle cap. Hold the dropper bottle straight over the top hole, not at an angle. Slowly put 6 drops into the top hole. Do not touch the card with the bottle tip. Now, collect your nasal sample. Open the swab package at the stick end and remove the swab. Be sure to keep your fingers away from the swab end. Swab both nostrils carefully. Insert the entire soft tip of the swab into one nostril, usually 1/2 to 3/4 of an inch. You do not need to go deeper. Using medium pressure, rub the swab against all of the inside walls of your nostril. Make 5 big circles for about 15 seconds. Using the same swab, repeat the swabbing in your other nostril. Next, perform the test. Keep the card flat on the table. Insert the swab tip into the bottom hole. Firmly push the swab tip from the bottom hole until it is visible in the top hole. Do not remove the swab from the card. Turn swab to the right, clockwise, 3 times to mix the swab with the drops. Do not skip this step. Leave the swab in the card for the remainder of the test. Peel the adhesive tape liner off of the right edge of the card. Be careful not to touch other parts of card. Close the left side of the card over the swab. Press firmly on the 2 lines on the right edge of the card to seal it. Keep the card face up on your table. Wait 15 minutes. Do not move or touch the card during this time. After 15 minutes, check your result. It is important to not read the result before 15 minutes. Results should not be read after 30 minutes. Next, check your result. To check for a positive result, look at the result window carefully for 2 pink or purple lines. Make sure you look closely at the bottom half of the results window, where it says sample. Even a faint line next to sample is a positive result. A negative result will have only 1 pink or purple line on the top half of the results window, where it says control. This means that COVID-19 was not detected. But if you see any of these results, the test is invalid. An invalid result means this test was unable to determine whether you have COVID-19 or not. A new test is needed to get a valid result. If you see an invalid result, please contact technical support at 833-637-1594. throw away all used test parts in the trash. Please share your test result with your healthcare provider. You should take a second test within 3 days, with at least 36 hours between tests. Together with vaccines, the Binax Now self-test can help people get back to doing what they want and need to do, like going to work and school or seeing friends and family, with greater confidence.